Have you ever left the doctor's visit with more tests, more meds, more follow ups than expected, and wonder if any of it was really needed? It can feel easier to say yes to everything, but in healthcare, more isn't always better. Here's the hard truth: more isn't always better. More tests, more prescriptions, more procedures, they don't mean better results. Sometimes they mean bigger bills, more stress, or unnecessary risk. The tricky part is overtreatment can feel like thorough care, but isn't always needed. In this module, I'll teach you how to recognize overtreatment, how to ask the right questions, and how to protect your health without feeling like you're second guessing your doctor. All right, for this module's agenda, we have why overtreatment happens, red flags for overtreatment, the three key questions to ask, use your insurance rules to your advantage, protect yourself without being that patient, understanding the hidden costs of overtreatment, real life scenarios, pro tip roundup, and closing and next step. Have you ever felt like your doctor was being extra careful and you weren't sure whether it was necessary or just routine? Understanding why overtreatment happens helps you respond calmly and make informed choices. Why overtreatment happens? It isn't usually anyone's fault, but it's built in how the system works, right? Sometimes clinicians want to be extra cautious so they don't miss anything. Sometimes plan rules like prior authorization or documentation influence choices. And sometimes more tests simply generate more charges without improving outcomes. And here's an example. After a car accident, Karen's doctor offered several CT scans despite no concerning symptoms. She asked if all were required. One was protocol, but not essential for her case. They canceled that scan, saving her time and money. Now, did you know research consistently show a meaningful share of US medical care provides little or no benefit? The exact percentage varies by study, condition, and setting, but the takeaway is the same. Asking a few clarifying questions help avoid low value care. Your role isn't to fight, it's to understand what's necessary versus optional so you can make informed choices. Being cautious is good, but being informed is better. Have you ever been offered a test or a referral that didn't match up how you were feeling? When something doesn't add up, look for red flags and ask why. This has happened to me when I went to the doctor, right? I was offered a few tests for safety and comfort, peace of mind, they would say. I said, is it really necessary? And they said, no, it's just a safety precaution. So it's very important to ask questions and know what's optional versus required. So here are some common red flags for overtreatment: repeat testing without clear reasons. Ask, what will this repeat test show that the last didn't? Name brand drugs offered when generics exist. Ask, is there a generic or lower cost alternative? Procedures proposed right away instead of trying standard steps first, like physical therapy before surgery, basic exams before advanced imaging, and also referral to a specialist without clear clinical question or goals. Now, here's an example. Tom had a mild back pain and was sent straight to the orthopedic surgeon. He asked to try stretching and activity modification first. 3 weeks later, his pain resolved, no MRI, no surgery. Now, did you know choosing wisely and other guided guideline programs list many tests and treatments that should be used only in specific situations? When in doubt, ask why now and what changes based on the results. These red flags don't mean your doctor is wrong. They mean it's time to start asking a few smart questions. Have you ever felt like you were pressured to decide right on the spot? This happens a lot of times in, you know, the exam room and in healthcare because you feel like you're rushed. There's not a lot of time. They're busy, and it's that pressure that makes you want to say yes to everything. Now, here are three quick questions that quickly separate a must do from can wait. When you're unsure and you need to pause and ask, say, is this urgent or can it wait? This clarifies risk in delaying. What happens if I don't do this right away? If the answer is not much changes, you will likely have time to consider options. Are there lower cost or non medical alternatives to try first? Often, lifestyle steps, watchful waiting, or physical therapy comes first. An example, Beth was told she needed a knee scope for mild arthritis. A knee scope is basically a keyhole surgery where doctors use a small camera to look inside your knee through tiny cuts to find the source of the pain. Beth asked if it was urgent. Her doctor suggested starting physical therapy. 8 weeks later, her pain was much improved, no procedure needed. Now, here's a pro tip: if your clinician says it is potentially urgent or dangerous to wait, that's your answer. If not, you can pause and decide on your timeline. Now, did you know several common conditions like uncomplicated low back pain, mild sinus symptoms, and some rashes? Guidelines support watchful waiting and conservative care before advanced testing or procedures. If you ever had a test that was denied and felt frustrated, sometimes plans rules can actually protect you from low value care. Now, use your insurance to your advantage. Now, health plans can sometimes actually help. Check if a service needs prior authorization. If approval is required, it's a natural moment to confirm necessity. Ask your clinician's office to verify coverage before scheduling. They can confirm codes, medical necessity criteria, and network status. If a service is denied, ask why and what documentation could help. Denials often resolve when clinicians' notes address the criteria. And here's an example: Mark's MRI was denied as not necessary. His doctor added symptoms, duration, exam findings, and failed conservative care to the note. The plan approved it on resubmission. Now, did you know plans use evidence based policies to determine whether a test or treatment is appropriate? That review can further filter low value care and keep you from paying what you don't need. A short delay for review can be frustrated, but it may save you from unnecessary care and cost. Now, if you're worried that asking questions make you look difficult, you can advocate confidently and respectfully. Most doctors appreciate a curious patient that is willing to have a conversation with them and talk about their care. Experts like to talk about things. So if you can spark their curiosity with letting them know that you want to know about your condition, the treatments, and ask questions. They're most of them are willing to answer them for you. Now, protect yourself without being that patient. So, here are some things you can say so you won't be that difficult patient. So, can you help me understand why this is the best option right now? Another one is, are there guidelines, recommendation for doing this now or later? Could we start with something less aggressive? Here's an example. When Michael's doctor proposed switching medications, he asked, is there a reason to the change instead of adjusting his current dose? The change turned out to be optional. He avoided an unnecessary switch. Now, here's a pro tip: use I statements to keep the tone collaborative, such as, I'm worried about the cost. Are there other ways to handle this? Or another one is, I want to avoid doing too much too soon if it's safe to wait. Now, clinicians are generally welcoming and engaging patients. Clear questions improve understanding and shared decisions. Respectful curiosity builds trust, and trust leads to better care. Now, have you ever gotten a maybe abnormal test and then spiraled into more tests and more stress? Overtreatment isn't about money, it can also create more problems. Now, understanding the hidden cost of overtreatment. Overtreatment is expensive and it could create new problems. Now, things like positives can trigger anxiety and cascades of further tests. Side effects from medication you may not need. This is another issue. Complications or downtime from procedures that don't improve outcomes. Now, here's an example. After a low yield screening test, Mary was told that she might need more workup. Later, it proved to be a normal variation, but she spent money and weeks of worry. Now, screening and diagnosis tests always have the possibility for a false positives and accidental findings. Asking about the benefits versus the downsides, including follow up tests, can help you weigh the trade offs. Sometimes saying not yet is safer and smarter than saying yes right away. Now, if it's urgent, if it can't wait, the doctor says, then go with his recommendation. But if not, it can wait. So let's practice. What would you say in these common situations to stay safe and avoid extra costs? So, real life scenarios. One, a CT scan for sinus pressure after a few days. You can ask, can we treat symptoms first and reassess? Many cases improve without imaging. Two, name brand prescriptions for high blood pressure. Ask, is there a generic, low cost equivalent? Your pharmacist can help check. Three, mild symptoms and a specialist referral. Ask, what will the specialist do that we can't start here? If it is the same plan, you might want to wait. Every question is a chance to avoid unnecessary costs, stress, and risk. So think back to your last visit. Where could a one question have saved you time, money, and stress? Here's your checklist. 1. Know the red flags. Repeat tests without explanation, brand only drugs, immediate procedures, unclear referrals are all red flags. 2. Ask 3 questions: urgent or wait, what changes, cheaper, less invasive first. 3. Use prior authorization and coverage checks as guardrails. 4. Stay calm and curious, not confrontational. 5. Remember, less can be more. You don't need to be a doctor to make smart decisions, just someone who asks good questions and take time to decide. These questions are very important. It is intimidating when you go into the doctor's office, so you have to remember to keep the confidence going, keep saying these things, write them down, and make sure it's a collaborative approach to your care plan. If they're the only ones saying anything and you're nodding your head, that's where issues can arise. So, what's one situation in your own care where you could have asked, is this urgent or could it wait? Start there next time. So, closing and next module. Overtreatment is a major driver of waste in time and money, but now you know how to spot it and stop it. You've learned to recognize the red flags, ask the right questions, and use plan rules as guardrails to protect yourself. Now, next, we'll focus on what happens after the visit, how to read your visit summary, track follow ups, and avoid billing surprises once you walk out the door. I'll see you in the next module.